Climate change and health is a developmental problem. And if we are able to put resources, and that's human and financial resources, into improving the development of our countries, then we become more resilient to climate change. It's as simple as that.
I think the level of interest and excitement around this program is pretty high. We've certainly seen evidence of the tangible result. So I would hope that the prospects are good for us to look at one or other mechanism for ensuring sustainability going forward.
Out of the many actions and activities that the program does, the fellowship was the one that struck my mind, my attention, as something very innovative, something very interesting, and as already been mentioned, very pertinent to building capacities and at the same time advancing the relevance and the prominence of this approach linking climate change and health.
We have been trying to develop our nations for the last decades, and this is the work that we want to continue to do. We want to be able to address these developmental challenges, to create resilience and to empower our populations and our communities to be able to withstand and adapt to the things that are to come.
So the fellowship that Dr. James worked on focused on the young people who live in perhaps a vulnerable community and educate them on the dangers of climate change.
Keeping it going, we seek funding and sponsorships from different organizations. So we partner a lot. So we partner with Sustainable Development. We recently partnered with the Substance Abuse Department, SACS, and with that, we get little help from them. Now, if we can get further sponsorship, then that will help us extend our reach so that we can reach far more persons that we're able to reach at the moment.
I'd just like to say that has been a real eye-opener for me. One thing is having Zoom meetings, reading documents, etc., and the other is actually meeting the people face-to-face, hearing from them their experiences, and seeing the level of camaraderie and the level of interest in moving forward with, I think they called it possibly a coalition or a league of climate and health experts moving forward. That's something that's very exciting, and I think it demonstrates the value that these individuals see in the experience that they've had, and perhaps more importantly, options for taking this work forward in a coordinated way internationally going forward.
Completing the one-year fellowship program by our esteemed 18 climate change and health leaders from 13 countries is a momentous achievement for the Caribbean region. With a target completion date of 2025, this project is not just important, it is becoming increasingly urgent in the context of climate change. Immediate funding is crucial to sustain our efforts to spread the message of climate change, its impacts, and how we can mitigate these risks. This message needs to reach far and wide, a mission that our growing number of fellows who are deeply committed are leading.
Take action for climate and health. Let's empower the Caribbean.